Hi, I'm Monica Ryan, a board-certified physician assistant in orthopedic trauma surgery. I've been practicing since 2012. I received my physician assistant degree in physician assistant studies at Mercy College in the Bronx in New York, and I practiced in New York City in Spanish Harlem for approximately 2 years before moving back home to the Milwaukee area. The type of patients that I generally see in practice are usually adult age from 18 all the way into their hundreds, but I am also certified at the Children's Hospital of Wisconsin, so I see pediatric patients as well. The types of conditions I generally treat are fractures, so fracture care in both operative and non-operative types of fractures, but I also treat soft tissue injuries, operative and non-operative, such as tendon ruptures, dislocations, and overall wound care. As far as areas of interest within what I do, I actually really enjoy orthopedic trauma because it does cover multiple areas throughout the body. So it's not just one limb or one part of the body. We see almost everything except for the spine, the hands, and the head. Generally, my approach to patient care is trying to get an overall idea of their whole situation. Trauma is kind of a special beast in that nobody ever comes to see us because something good happened. It was generally something unplanned, sudden, and so there's not only the injury that we have to treat, but there's also the social aspect of how the family's doing, how the patient's doing, trying to coordinate sometimes multiple injuries across multiple different services within the hospital system. So it definitely focuses on the injury that we're taking care of, but a lot of other things as well. One of the things I really like about my specialty in orthopedic trauma surgery is that I see the patient in multiple settings. So I see them in clinic, I also see them in the operating room, and at times in the inpatient setting as well. So it's kind of all-encompassing. I also really like that we see them when they first come in the door, and generally, you know, things aren't going very well for them, but one of my favorite things is when they're at their end of treatment and they're up and walking out of clinic feeling a lot better and healed, and you get to say goodbye to them.